Hi, ladies and gentlemen. It's a pleasure to be back again. So, welcome back to Brain Gist. Today, I will talking to you about a very common condition which we call carpal tunnel syndrome. It is perhaps the commonest cause for which people experience numbness and tingling in their hands. It's extremely common. So if that category fits you, or you fit that category, do stick around till the end and enjoy this video and learn from it. So this is Brain Gist. In case you're new to it, this is a channel dedicated to educating people about everything that has to do with the brain, the spinal cord, the nerves, the muscles, every part of a nervous system. So do hit the subscribe button if you like what you're saying, you'd like to benefit more in the future. And of course, turn on your notifications so you can get notified when videos of this nature are released. And do give your comments, share the videos. All right, so welcome back. So today we talk about carpal tunnel syndrome. So what is carpal tunnel syndrome? So what I like to say to my patients is, if you imagine driving through a tunnel, so in a similar vein, so we've got some tunnel somewhere here, and this is the carpal area or the hand area, and that's why it's called the carpal tunnel syndrome. So it's a set of symptoms or a syndrome that results from a problem within the carpal tunnel. So there's a small tunnel here, like a space which has got a roof and has got, more or less like a cylindrical passage there, through which passes to which pass over some important structures coming from the forearm and going destined for the hand or the finger. So they pass through that space or that tunnel. You can't see it because it's covered by the skin and the underlying soft tissue, and there's a tight covering, another tight tissue covering for the tunnel. But inside of that space, it's a relatively tight space. So you've got so many tendons. When we say tendons are actually like the tough part of meat. When you eat meat, sometimes you feel that stringy part of it, or that tough part, and that's called tendons. You can really feel them here. The tough bands, the extensions of the muscles here, and they come together to form a bundle and they pass through this tunnel. Okay, and then other important structures to go through include a particular nerve that goes together with these tendons through this potentially tight space, actually. So they'll pack themselves inside of that tunnel and they cross into the hands. Now, this particular nerve that passes with the tendons through this carpal tunnel is called the median nerve. And we have so many other nerves in the hands, but this nerve singly passes through this tunnel along with these other tendons, forming a relationship with them. So in some individuals, that tunnel becomes even tighter, especially in conditions in which there is swelling. So for various reasons, the space becomes too tight, and then there's now increased pressure on that nerve. And when there's pressure on the nerve begins to cry. And it's the cry of the nerve that leads to the tingling and the numbness in the hands. And we usually very carefully examine in the clinic to be able to delineate the territory of sensory disturbance resulting from this carpal tunnel syndrome of pressure or impingement or pinching of the median nerve. So the median nerve actually helps us to move certain muscles, small muscles in the hand, and also helps us to feel. For example, even with my eyes closed, if somebody strokes my fingers, I can feel them. So this feeling is made possible because of the activity of that nerve, the median nerve. So the median nerve actually helps us feel through this thumb, this finger, and then half of the ring finger. So sometimes in the clinic, we were able to carefully examine and delineate some sensory loss in that territory of the median nerve in those who've got carpal tunnel syndrome. And how do you know if you've got carpal tunnel syndrome? You typically would have either pain, numbness, or tingling, in your hands, usually going down this distribution I've explained. And sometimes the symptoms are worse in the night. They tend to wake the individual up. And some of my patients typically say they wake up to shake their hands to feel some relief from the symptoms, and sometimes it persists during the day. And then, so most of the times it's sensory disturbance. And then if it progresses over time unaddressed, then it can lead to permanent loss or a more sustained loss of sensation completely in that territory. Pain can occur. And in the most extreme of cases, people begin to lose their muscles, and you begin to see some guttering in that area where the muscles are. For example, if you look on the screen, you can see this picture nicely drawn. The carpal tunnel space, we can see the nerve going through it. The yellow structure here is the nerve, and as it fans out to the fingers. And you can see it's surrounded here by those tendons, and you can see the tight covering, and you can see the muscle. So if there is carpal tunnel, you're going to have increased tightness and pressure within this space, and then you're going to have this nerve beginning to suffer, and then you begin to have pain radiating down. You can begin to have numbness, and in the extreme of cases, you might lose your muscles. And then why do people have carpal tunnel syndrome? Well, sometimes we don't have an explanation for why it developed, but some of the risk factors that we know include things like pregnancy, because we know in pregnancy there is swelling in many parts of the body, in the feet, in the face sometimes. And so there is also swelling inside of that space, carpal tunnel space, and therefore that swelling puts more pressure on the nerve. And it's not uncommon to see pregnant women coming down with this. And sometimes it happens just after delivery, and then they start to calm down with this numbness and tingling in their hands. And then those who have low or underactive thyroid, that tends to happen in those who are secretaries, who do a lot of typing and wristy movements. We tend to see that. And those with some other conditions like kidney problems. But sometimes the individuals have no medical conditions, and yet they have carpal tunnel syndrome. Of course, another cause that just came to mind now is diabetes, or another risk factor, I should say, another cause. So one of the common risk factors will include diabetes. So those who've got diabetes are more prone to having it. And sometimes we're just testing people for some other reason, and we discover they've got carpal tunnel syndrome, which is asymptomatic, meaning that it's not causing them symptoms. So we've talked about the symptoms, we've talked about what it is, we've talked about what causes it, or what are the risk factors. And then now we need to talk about how do we diagnose carpal tunnel syndrome. So if you have any of the symptoms, you need to see your doctor, and then your doctor will typically refer you for what we call a nerve conduction test, which I did in my previous video explaining what this test is about. So you can refer to that. So we study that nerve, and the principle of the test is we stimulate the nerve just before it passes through the tunnel, and we record after the tunnel. And we already have an idea how much time it should take for the electrical signal to cross to that, to the point where we're recording from. But in those with carpal tunnel, there's going to be a delay because of the obstruction on the nerve, and then we can usually pick it up on the test. And we can usually tell you the severity of a carpal tunnel syndrome, be it mild, moderate, or severe, or very mild, or very, very severe, or extremely severe. So we've got grades, and that also impacts on what the treatment recommendations are. So because over time the nerve can be really damaged, and then if that's the case, then in such individuals you might really not want to recommend conservative treatment. You may want them to go for more drastic treatments to save the nerve. So treatment recommendations vary. So usually it starts from, with the mildest of cases, we might just say, okay, go for a splint, a splint to immobilize the joint here while you still have freedom to use your fingers, but it prevents you from having extreme flexion of the wrist, which can increase pressure within the tunnel, especially at night. So the splint is worn at night or even during the daytime as well. That's really the first measure. And if that fails or doesn't work for about 6 weeks, you've tried it doesn't work, you're having extreme symptoms, you might go for physical therapy, where they try all sorts of modality to try to reduce the pressure on the nerve. And if that fails, usually we'll try some injections into the tunnel to try to reduce the inflammation there, and the swelling, the pressure on the nerve. And if that fails, then you might need to go for like a little surgery to open the space up and create more space. So basically to allow the nerve to have space, and then things can resolve. So thank you so much for watching today. I do hope you learned something, and I'll see you in my next video. Bye and stay safe.